safe way. So as Dr. Kogan mentioned, I study zoonotic diseases. I am very interested in some of the behavioral elements that might lead to exposure risks and how we can come together to create a safer environment for both humans and animals. So it's a One Health framework that I utilize. So with that being said, I really want to stress that this discussion today is going to highlight some areas that do present a risk for both humans and animals within these animal-assisted therapy settings, but this should not dissuade you or discourage you from beginning or continuing a program for your patient population. So I just want to make sure that if you decide to do it or you become a part of it, that it's safe and healthy for everyone. So today we are going to talk about animal-assisted therapy and zoonotic disease. We are going to cover a few of the learning objectives on the next slide, but we will also be defining what animal-assisted therapy is and how it fits into the overall umbrella of animal-assisted interventions. We'll describe just a few of the many published studies and the data that's out there to support animal-assisted therapy as a treatment modality. And then on the flip side of that, the other side of the coin, is that we are going to talk about some of the health risks that can be associated with animal-assisted therapy for both humans and animals, and some of the directional risks that that could become a problem. At the end, we're going to go through some of the recommendations that a healthcare accrediting body who does infection control and prevention has recommended for the implementation of quality animal-assisted therapy programs within hospital-based or healthcare settings. And so some of these recommendations would be applicable to your clinics or your own facilities. So some of the learning objectives today are that by the end of this webinar, I'm hoping that you'll be able to describe the difference between zoonotic and reverse zoonotic disease transmission. You'll be able to list at least 2 exposure risks for zoonotic disease transmission, particularly ones that may be associated with an animal-assisted therapy setting. And you'll be able to identify 3 or more specific areas of focus for an animal-assisted therapy safety plan that might be applicable to you or a facility that may be wanting to implement this program. So the animal-assisted therapy definition, it's quite different than any other program that you might be looking at. Animal-assisted therapy is therapeutic use of animals. So it's not just having contact with snuggly animals or companion animals. This is when we're wanting to actually enhance the functioning of a patient or a population. So we can think about them in terms of physical, social, emotional, and cognitive functioning capabilities. And so we're really trying to elevate kind of the degree of the contact that we're having so that we have a decided influence and impact on health. And the reason that this is different is animal-assisted interventions as an umbrella term can be anything from just contact with an animal at a library or walking an animal through somewhere to just put a smile on somebody's face. Kind of more broad use of animals within settings would be an animal-assisted intervention. Whereas an animal-assisted therapy actually has a set goal and objective for what the outcome should be or what the outcome is intended to be in terms of treatment. Animal-assisted therapy will have oversight from a trained handler or a healthcare provider who is assisting in that implementation. And then it utilizes a trained therapy animal. So there's a little bit more oversight, a little bit more rules, and a little bit more rigidity to animal-assisted therapy to make sure that you are pushing forward for that goal of a specific treatment outcome. There are lots and lots of therapy animal programs and organizations out there. This slide is just going to mention a few of the ones that are here in the United States. You can look up several more. There are plenty of international therapy-assisted or animal-assisted therapy programs and organizations that you may want to look at and see if there may be a program or a style or organizational tone, even mission statement that your group might be interested in. And you could reach out to some of these groups and see how they got things set up and how they are assessing their own safety plans. So now we can talk about why you may want to consider this type of programming for your own patient or client population. There's many proven health benefits of animal-assisted therapies within the healthcare setting. We know that they are effective for both individuals and for groups, and they can help to combat challenges related to social, emotional, behavioral, physical, and cognitive challenges. I've seen effects of animal-assisted therapy within acute and long-term facilities, within shelters that house both prisoners as well as homeless individuals, and even rehabilitation centers surrounding drug and alcohol use. Animal-assisted therapy has been successfully applied to post-conflict shelters or national disaster conflict zones, things like that, as refugee camps, internally displaced person camps, as well as within educational centers and schools, summer camps, places like that, and even in just general wellness programs for regular employee health centers. So some of the studies that have been done on the therapeutic animal-assisted therapies have shown quite a bit of success in different settings and disciplines. So this slide illustrates just two examples of some fields that have utilized and experienced successful effects of animal-assisted therapy. So an example is within physical therapy, utilizing a therapy animal for a patient to work on their motor skills, and that can be done through asking the patient or client to walk, pet, or even brush the therapy animal. And in mental health counseling, therapy animals have been used to try to elicit a bond and to help with dialogue and to get information and to get a client talking. And this is especially successful with children and other groups who may be a little bit more high risk or more vulnerable. So the best part of all of this is that we actually have data to support these anecdotal stories. We know that they are effective. A meta-analysis was done several years ago when the field was still becoming popular and we were just starting to see some data coming out of it. And this is when we found that the animal-assisted treatment programs were either as effective or more effective than the traditional interventions within the setting that they were looking at. And they found that they were especially successful when they were looking into patient populations concerning autism-related illnesses, medical difficulties, surrounding behavioral problems, emotional well-being, and the like. Now, years later, a systematic review was done, and we found similar results. Now, this systematic review was looking at all animal-assisted interventions, so even some that are not held to the higher rigor of an animal-assisted therapy program, and they were looking at how these animal-assisted interventions were working within a hospital setting. And so they found that the animal-assisted therapy programs were quite effective in the reduction of pain, stress, depression, and anxiety, and that the intervention and so the overall animal-assisted intervention and the animal-assisted therapy programs in particular even had positive effects on a patient's vital signs and their nutritional intake. So research has shown that animal-assisted therapy can reduce stress, depression, anxiety, and loneliness, can lower pain, blood pressure, and even a sense of isolation. Animal-assisted therapy has been used to increase nutritional intake and physical activity among different populations, which has led to more civic and community engagement, has increased socialization, relationship building, and self-esteem, has also led to an assistment in the recovery of diseases and illness, so people actually recover faster when animal-assisted therapy programs are utilized. They also have been shown to fight obesity, and this is just kind of a snapshot of some of the health benefits of animal-assisted therapies. If we want to go more into some of the nitty-gritty details about what we're seeing with different patient populations, we can see that within chronic schizophrenic patients that have been utilizing an animal-assisted therapy program, they have shown an increase in their self-esteem and their self-determination, and they have shown a decrease in psychiatric and emotional symptoms, as well as violent incidents. And some of this research has been done with canine animal-assisted therapy programs, as well as equine, so horse therapies. We have actually been able to see less violence and calmer demeanors within prison populations when they were allowed to have contact with animals and pets. And a study was done in which stockbrokers were given medication for combating hypertension. And when those same stockbrokers were given medication coupled with an animal-assisted therapy program, they actually had much better results. So if you can think about it as a therapy program on its own, or something to elevate a standard treatment of care. We have found that among cancer patients, animal-assisted therapy has been extremely useful in reducing pain, but also reducing feelings of loneliness and increasing relaxation, socialization, and self-esteem. Now, the very cool thing about some of this research of animal-assisted therapy within these cancer patient populations is that you were seeing a positive effect not only with the patient, but also with the caregivers and those who were assisting with the treatment plan of the patient. We have seen that women who are experiencing complicated pregnancies have really benefited from a canine animal-assisted therapy program that helped to lower their depression and anxiety, which can lead to much more healthy and successful pregnancies and deliveries. Within our older population, we've seen tremendous benefits from animal-assisted therapy programs and animal-assisted interventions. In elderly patients within a long-term care facility who were working with a feline therapy program, they had a reduction in their depression levels and their blood pressure. In an Alzheimer's patient's facility, when an aquarium was added to the facility, they actually increased their nutritional intake and healthier weight. So they have shown that just having animals nearby, even when direct contact cannot be had, just seeing the animals can assist with some of these health outcomes. This also happened when caged birds were added to a geriatric ward of a hospital, and patients were reported to be more curious, more attentive, and they really wanted to help in the care of the animals. So you can see that there are many health benefits of animal-assisted therapy programs. We see a lot of different types of patients, a lot of different settings in which there are positive outcomes from these different types of interventions. But, just like, everything in life, with the good, there is some bad. So we really want to make sure that we are highlighting all of the benefits by addressing any of the risks that this contact or this therapy program may be presenting to our populations. We really want to focus too on any patient population who is more vulnerable. So when we're thinking about any kind of zoonotic disease risk, this would be patient populations who are immunocompromised, especially. So our young, our old, our pregnant, anyone who is battling an infectious disease or a chronic disease such as cancer, we want to really be looking out for them. And the reason that we're thinking about zoonotic disease is we have evolved right alongside our animals. And this includes wildlife, our companion animals, livestock. We've all been mixing together on the same environment. And because of this coevolution, we have a lot of the same pathogens that can influence our health. In fact, there's over 200 known zoonotic diseases in the world, and that number continues to grow with every week. We have a new discovery of a potential pathogen of harm to both humans and animals. When we are thinking about diseases and illnesses that can be shared between an animal and a person, we are thinking about zoonotic disease. So these are a specific type of infectious disease in which they can be shared from an animal to a person. So when an animal does spread a disease to a person, it's called zoonotic transmission. And this happens a lot. About 60% or even more of the infectious diseases that we get as humans are zoonotic, meaning that we have the potential to get them from an animal. Now, 75% of the emerging or re-emerging diseases that we're seeing, and so maybe these headlines that I'm talking about, a lot of those are going to be zoonotic as well. So seek and you shall find. So we are doing a lot of really interesting virus hunting among that human-animal interface, and we're finding a lot of shared pathogens. And we have these disease categories across bacteria, parasites, viruses, fungi, and prions. So zoonotic disease exposure, what we're really wanting to consider is what type of animal species we may be having contact with. So what animals are going to be utilized within the animal-assisted therapy program at your facility, or maybe ones that your patients are going to be having contact with. And then we want to think about what type of contact we are seeing or the patient is having. So when we are worried about a zoonotic infection or the severity of an infection, we're thinking about that immunostatus of the person, as well as the virulence, so the type of pathogen that they are being exposed to. And all of this will be important for us to figure out not only how to prevent any kind of exposure from happening or the transmission, but also if an infection does occur, we'll be better able to respond to that, whether that's in the human or the animal. So zoonotic diseases can come from many pathways and many exposure types. So again, it's just important to think through all of this so that we can consider how best to protect our patient and therapy animal population. So zoonotic diseases can come from different bites or scratches. They can come from inhalation of infected particles, contact with infected urine, direct contact with contaminated animal fur, feathers, skin, or even their bedding or other items that have touched infected animals. And so there's these infectious particles on these items. And then the most common is accidental fecal oral ingestion. So we're really going to consider a lot of these zoonotic disease transmission routes, but I also want to highlight that there are just physical injury risks associated with assisted animal therapy programs. So besides the risk of disease that could come from a bite and a scratch, there are also physical injuries that we need to think about. In addition, when you have an animal and a leash or some sort of a harness and it's walking around in a room, we want to be thinking about where cords are, where caregivers are, where the different guests are coming in and out, so where people's feet are, different medical devices are plugged in, so we don't want there to be any trip hazards or anything to get accidentally pulled out of the wall. So on the next couple slides, we're actually going to discuss some zoonotic disease examples, and we're going to think through these different disease transmission routes. So the first one we can talk about is zoonotic disease, a zoonotic disease example that can come from a scratch from an animal. So Bartonellosis is also called cat scratch disease or cat scratch fever. This is a bacterial disease, and it can happen when a cat has scratched a flea bite, and it happens to be a flea bite that occurred from an infected flea with this bacteria. So when fleas bite an animal or a human, they bite in the same area that they are defecating. So if you go to scratch that area, you can get some of the feces under your nail, just like a cat could get it under their nail. So a cat scratches that flea bite and then either purposely or accidentally scratches a person, and because they had that infected flea stool underneath their nails, it's now put it through the skin break of the person. So that's something to consider. If you are working in any kind of animal-assisted therapy program that utilizes stray or rescue cats and kittens, we're going to really need to be assessed fully before they are able to have contact with patients. And that's to prevent this, because this is something that we do see a lot in our feral or stray cats. And so we want to make sure that they are healthy before they get invited to participate as a therapy animal. Bartonella is not just a cat-related infection. This is one that can be transmitted by dogs and other domestic and wild animals, including rodents. So I don't want to throw cats under the bus for that one. An example of a zoonotic disease that can come from an animal bite is pasteurellosis. Pasteurellosis is a bacteria. It can come from the bite of an infected animal, and so the infected saliva can actually get inside of the wound if an animal bites and breaks the skin. But it can also occur when an infected animal licks a wound. So you would really want to be careful if you have any patient population or any clientele who have broken skin. So you wouldn't want an animal that could potentially be infected to lick or be able to get their saliva near that open wound. Zoonotic disease can also be transmitted simply from breathing the wrong particles of aerosolized bedding or potentially excrement from an animal. This one is mostly a bird-based zoonosis. It's psittacosis. It's also called parrot fever. So there you get the bird association. This is something that can happen when an infected bird excretes the infectious organisms, so the infectious particles can get on the bedding, the cage materials, potentially food or toys that are in the cage. And so if there is a chance for psittacosis to be an infection within a therapy animal bird, you want to make sure, well, first of all, that you're treating the animal itself. But if there's any doubt at all, you would not want anyone who's immunocompromised to be responsible for changing the bedding or assisting with the care of that animal. Zoonotic disease transmission can also come from infected urine. So this is a threat when it comes to leptospirosis. Contact can occur if an animal-assisted therapy program allows for any kind of accidents. So any accidents that are not cleaned up right away or that aren't cleaned according to the environmental hygiene standards of the facility. You can also get this disease if you have come in contact with contaminated food or drinking water, and then that infected urine can get into that, and that's where we see some problems. If you have a skin or mucous membrane that has contact with urine contaminated water or soil, that's another way for this to be transmitted. It's typically associated with rodents. It can also be found when we have flooding in some areas. The reason it's associated with rodents is because rodents use urine as a scent marker. So they are urinating and talking to one another through that urine. And as they do that, they are marking territory and picking it up on their own paws. And so they can spread it very easily that way. Other animals, such as dogs, can also be infected with leptospirosis. So again, not just going to throw it on one animal here. Now, a zoonotic disease that can be transmitted from direct contact is one that you might be more familiar with, and that's ringworm. A dermatophyte fungi species, such as ringworm, can be transmitted through touching an infected animal's skin or their coat, or by having contact with an animal's infected skin lesions. But it can also be transmitted simply by handling the bedding or other items that have had contact with an infected animal. And finally, we have come to the area that I study the most, and this is fecal oral ingestion. Now, this is when we have typically a diarrheal disease that has been transmitted from the accidental ingestion of fecal particles. Now, this can happen quite easily, and if any of you have experienced any gastrointestinal problems over your lifetime, more than likely it was due to an accidental fecal oral ingestion. I'm sorry to tell you. One of the most common parasites that we're going to see that is a big driver of our diarrheal disease is cryptosporidiosis. Now, this is caused by the Cryptosporidium species of parasite. Most animals that are going to be used in any kind of animal-assisted therapy program can be a host for this particular parasite, and that includes dogs, cats, reptiles, horses, birds, you name it. There is a species of Cryptosporidium that can influence them and also be transmitted zoonotically. These very tiny but potentially very dangerous fecal particles can get onto our hands, on our food and our water. They can be on our floors, on items we touch or handle, but they can also be carried on the stomach, inside the stomach, or even on the legs of filth flies. Now, filth flies are the type of flies that land from excrement to food. So they're the ones who are carrying some of these pathogens for us. So just another thing we want to be looking out for. We want to make sure that we're cleaning up any kind of soiled area right away. Now, in global health, when we're thinking about diarrheal disease exposure risks, we often use what's called the F diagram. So this F diagram is showing different exposure routes for diarrheal diseases. So if you have some sort of an accidental fecal oral transmission, most likely it's going to come from one of these different exposure routes. So what happens is on the far left, you have an infected host, the feces of an infected host. This could be a human or an animal. Their infected fecal particles either get into our water, on our floors or surfaces or other fields. They can get on our hands, or they can be carried by those filth flies that I mentioned. Now, these particles on their own can influence the health and impact infection of a new host, or they can actually then get on our food sources, which then can lead to an exposure risk to us. So if you think about this diagram and you try to understand different areas in which we may have fecal oral exposure from an animal-assisted therapy program, you can start to figure out ways that you can put up barriers and try to incorporate good control efforts to prevent that transmission. Now, those are a few different specific zoonoses that are attributed to the different transmission routes that I was using as examples. But unfortunately, like I mentioned before, there are over 200 zoonotic pathogens that we know of. So that was just a snapshot. Here are a few others that we really want to be thinking about when it comes to animal-assisted therapy programs. So we've got different parasites, viruses, bacteria, fungi, and like I said, there are even prions. So when we're thinking about all of these different zoonotic diseases, you would like to think that you would be able to spot the culprits, that they would already be sick, but that's not the case, especially with our animal population. We can have infected animals that are completely asymptomatic, and so it's our responsibility to be on the lookout for the exposure risks and to be trying to head off anything before it happens. And we know that this happens because a recent study looked at zoonotic pathogens among dogs that were being used within hospitals for patient visitations. And they did a study of 100 healthy dogs, so none of these dogs had any signs or symptoms of illness, but 80% of them had zoonotic pathogens. And they ranged from quite specific, more unique pathogens that they were unexpected to see, to some that are considered very dangerous hospital-acquired infections and hard to treat. So if we're thinking about these exposure risks, we have to be thinking about the different ways that the transmission can occur, because even with this study, we're not 100% sure how these dogs got it. Now, you want to think that, you know, the dogs picked up these pathogens from the hospital and they're a threat to the patient, which may be true. However, we might have seen the opposite direction. So they could have picked it up from the hospital itself. They could have picked it up from other therapy animals, from walking around with their owner during their time off, or they might have got it from other people. And so we want to also be thinking about how humans play a role in the transmission of these pathogens. So zoonotic disease transmission typically is what we're thinking about from an animal to a human, but we can also infect our animals in a process called reverse zoonoses. So this is when we're having these same pathogens that are actually originating in a person, and then we are responsible for the infection of animals. So it's really hard to look for that direction of transmission. Sometimes we can do some trace backs and figure it out, but a lot of times we aren't going to be able to point the blame where it went. And maybe it doesn't even matter, because we want to be just as vigilant at protecting our therapy animals from infection as we want to protect our patients. So now that we have done a little bit of background on some of the health benefits and some of the specific health risks, it's important to kind of gauge where we're at. So the animal-assisted therapy community has been talking more about zoonotic disease prevention efforts and trainings. But at the current time, we are not at a level where we have good knowledge, perceptions, or attitudes concerning our zoonotic disease risks. In fact, there was a study that was done among animal-assisted therapy programs, and respondents said that although that they were concerned about zoonotic disease control, they were only aware of a few pathogens that could cause infection, and they were just thinking about rabies, that ringworm, and some diseases caused by ticks and fleas. So they weren't even thinking about those diarrheal diseases. A large majority of the respondents said that they did not have a printed or accessible guideline on the prevention of zoonotic diseases within their animal-assisted therapy program, and their programs were not engaged in healthcare professionals, with healthcare professionals in the development of these efforts. Several studies, including one that was recently published in 2017, found that policies for the protection and safety of animals and participants in our therapy programs varied widely. So I believe that was, these two slides here. So even though the general public has a lot of experience with animals, a study found that 64% of animal owners had never received any information about zoonotic disease threats. So we cannot expect that our patient population is educated on the zoonotic disease risks. So if we're going to be introducing these animals into their care or into a care plan, we are responsible for that type of education. We also found within some of this research that even households that had immunocompromised individuals, such as the children under 5, adults over 65, pregnant and breastfeeding women, persons with cancer, HIV and AIDS, or those missing spleens, those households had also not received any instruction about zoonotic disease risks from their healthcare practitioners, from their veterinarians, or anybody. So we really want to be the educators and be the responsible parties if we're going to be implementing these types of programs. When we don't do it, we are going to have problems. And we know that because there have already been several outbreaks associated with zoonotic disease within healthcare settings. For example, an outbreak of MRSA among a geriatric rehab unit was associated with a cat that lived within the ward. This cat tested positive for MRSA colonization on the feline's paws, as well as a swab of its fur. Within an intensive care nursery, an outbreak of Malassezia pachydermitis was found, and when they were able to trace it back, it was part of a healthcare worker's colonization from her 3 pet dogs that she had at home, and she unwittingly spread the pathogen from the dogs to patients, and it infected 15 patients, 9 infants, and another healthcare worker. And there was another outbreak of salmonella within a hospital nursery, and this particular one was traced back to the index patient's mother who had infected calves at home on her farm. So that's just a couple outbreak examples in healthcare settings that are associated with zoonotic pathogens, just to give you a reminder about how important it is to have control guidelines and policies in place for the prevention of these diseases. As of now, there are no policies that have to be adhered to within animal-assisted therapy programs. So we don't have uniform zoonotic disease exposure guidelines or prevention strategies. When there are policies, they seem to be only related to rabies vaccines or the prohibiting of raw food diets among therapy animals. When we do see these policies, they're not strictly enforced. So unfortunately, there is no governing body or regulating agency that anybody can go to that has any teeth to support compliance with these policies. And until those changes are made or there is an effort to have such a safety and health regulating agency, then we've got to do it ourselves. So it remains up to the individual facility and therapy program to both create and administer their own infection control and prevention strategies and regulations. Now, luckily, the Society for Healthcare Epidemiology of America has created guidelines for the use of animals in healthcare facilities. These are just guidelines, so it is up to each agency and organization and facility to look through them and to find a way to implement them as they make sense for their program. So the next few slides, we will start to talk about some of these recommendations from SHEA. Now, I am not a member of SHEA. I can't speak for the organization. They do have their guidelines, which are available, as well as you can print them out and order copies and things like that. But I do think it's important to go through some of these recommendations because we need to be thinking ahead and figuring out ways in which we can make a safer interaction between our humans and our animals. So SHEA recommends that facilities have a formal written policy. So we need to make sure that we've got our rules in place and that they should be used at the facility as well as the animal-assisted program itself should be well aware of them. Certain animals should not be allowed to be in these therapy situations. And that's because we can't ensure that all species of animals can be called on command. Not all of them can be leash trained. And so we want to make sure that we have animals that we can control where they go and where they don't go, as well as being able to make sure that they are secured. And that's going to protect the animal as well as patients. And we think about high-risk areas where we don't want animals to be. One would be a food preparation area, as well as some units that may have severely immunocompromised individuals, such as a transplant recipient. When we do have our animals selected, there needs to be a formal screening and training and as well as an evaluation of both the therapy animal as well as the handler. And that's to make sure that everybody's healthy and everybody knows how to be safe and successful at the facility. Not all locations in a hospital are going to be ready or safe for animals to be in and out. So consultation with your infection control specialist at the facility or the organization can help create a safe plan that's going to protect both the therapy animal, the handler, and participants, as well as other patients or other people who may be utilizing the space. Everybody who works in the facility should know what the rules are and how to enforce them and how to be in compliance. And that just makes sure that everybody's on the same page and there isn't anyone that's at risk for infection or injury. Therapy handlers should recognize that the role of infection control specialist is important and vital at the facility, so they need to know what recommendations and what rules are already in place that are protecting patients and guests. So if there is a procedure about how to do hand washing after patient contact, then everybody should be doing that. So talking with your infection control specialist will help you understand what the rules are. Since handlers are going to be exposed to the same hospital-based infection risks as the clinical staff, they should be able to have access to the same immunizations that are offered to the healthcare workers. Therapy animal handlers should be in charge of the animal at all times and making sure they're following the rules. And that's going to make sure that the animal is safe as well. One thing that's important to note is that although a lot of people are going to want to interact with a therapy animal within these different settings, it's not always safe for all people to do so. And so you want to make sure that you are not exposing someone who is at risk or immunocompromised to these types of infections. You also don't want anybody who has a fear or anxiety or just doesn't want to touch the animal, or maybe has a dog allergy. So you don't want to just kind of let the animals go willy-nilly and have contact with everybody. You want to make sure that it's purposeful and that you're thinking about these infection risks for both the animal as well as your patient population. It's best if there's only one animal per handler, and that's to make sure the handler as well as the animal can be safely managed. Shea recommends that their therapy animal handlers be trained on specific areas of disease prevention and patient safety. And this includes zoonotic diseases, hand hygiene, and personal protective equipment, what might be needed to be worn for certain patients that are under different contact isolation, how to safely dispose of animal waste and clean the area, best practices for examining a therapy animal for fleas, ticks, mites, any kind of ectoparasite like that. Body language of an animal to make sure that an animal is happy to be there and isn't overstressed or in pain. We want to make sure that if an animal is agitated, that they can be removed from a situation so that they don't pose a risk or become injured themselves. And they should also be trained on how to record and manage contact information should there be an emergency or any kind of tracing that needs to be done. So again, although people are going to want to have contact with a therapy animal, it's up to the handler to make sure that the patient, caregiver, healthcare provider, whoever the participant has been selected to be, that they're the only one having contact, and that contact is not within these high-risk areas of the animal. And those include mouths, nose, and the undercarriage, if you can go back to that fecal-oral concern. So that's going to make sure that we're preventing any kind of transmission risk for zoonotic disease, but it also helps the animal because they'll stay calmer and safer and happier. Speaking of the animal, it's best if we can limit sessions to a max of 1 hour. Just like people, animals can get exhausted, so we want them to stay sharp and happy when they're on the clock. Animal handlers are expected to self-evaluate their own health. So going back to that reverse zoonoses, we would not want a handler to be the ones who are bringing in some sort of zoonotic pathogen or otherwise. So we want to make sure that if they themselves are sick or not feeling so good, that they sit that one out. Therapy animal handlers must be in control of the animal at all times. And if you're thinking about where, in particular, we're thinking of when the animal might be approaching a patient in a bed, think about whether that patient has any bandages, any skin injuries, those medical devices and cords. Also when riding in an elevator, in hallways, tight confined spaces, you want to make sure that the only people that are having direct contact with the animal are the intended population. And then if there are any issues in terms of a bite or a scratch, that they're addressed right away. If an animal is ill or becomes ill, they should be removed right away. And that's going to protect the animal from any potential transmission risks and to keep the animal healthier. A log of any kind of animal-assisted therapy visits should be maintained, and this will help to ensure that if an issue arises, everybody can track back to who might be infected or have been exposed to something, and that's going to, again, keep everybody safer. Animals have personalities and they have their own desires, and so just because they enjoyed therapy the first time they went out doesn't mean they're going to enjoy it forever. So a screening of the therapy animal temperaments and their behaviors should be an ongoing thing. It shouldn't just happen one time and then they're let loose within a program. And the animals should be screened for their own health status, so making sure that their rabies and other vaccines are up to date. If an animal is ill, they need to be sat out for a little while until a vet can give them the all clear. They need to be having full health exams by certified veterinarians at least once a year. So just like we would like to have physicals once a year, we need it for our working therapy animals. And any animal who's consuming a raw diet or dehydrated food items should be prohibited from participating. And this is to prevent the risk of foodborne pathogens. We've seen a lot of diseases associated with these particular diets, such as E. coli, salmonella, toxoplasmosis, and others. So we want to make sure that we are protecting our patients as well as the animals. Therapy animal handlers should be making sure the animal doesn't have any loose hair, that their nails are short and clipped, that they don't have any fleas and ticks. And some of this is just going to be common sense and what we would expect out of proper care for a therapy animal. But having it within your policy will really make sure that you have a way to conduct some oversight on that animal health. You'll want to probably have something related to like a retractable leash to make sure, or a non-retractable leash to make sure that control can be maintained. And you want to make sure the animal has a place to relieve itself, as well as the animal handler a place to wash his or her hands. Again, not everybody's going to want to have contact with a therapy animal, nor should they. So anybody who does have contact should have already gotten permission first. So the handler needs to get permission from a patient or caregiver, particularly from the healthcare provider as well, if they're going to be initiating contact. It's really good if everybody's on the same page. So all healthcare workers that are responsible, or everybody part of somebody's care team, should be notified that the animal is going to be there. Certain areas, again, should probably just remain off limits. Now, this is going to be a case-by-case basis, but in general, ICUs, isolation rooms, nurseries, and other high-risk areas are not going to be spots where animals should be, and that's just to protect our highly immunocompromised patients. If a therapy program or intervention means that the animal gets on the bed, there should be a barrier in between the bed sheets and that animal. And again, this is going to protect both the patient as well as the animal itself. It's difficult to do, but patients and healthcare providers should be discouraged from touching an animal's paw or from feeding the animal. And this is, again, to stop the exposure risks of these high-risk areas. It will also protect your therapy animal from the germs on the patient's hands. Therapy animals should not be encouraged to lick patients or healthcare providers. Again, this may be a case-by-case basis in terms of who you're working with population-wise, but you want to try to protect that patient and that therapy animal. And once a contact has occurred or a therapy animal program has happened, you want to make sure that cleaning services are scheduled and that the space remains clean and safe. And finally, if an animal got onto the bed or had contact with bed linens without a protective barrier, it'd be a good idea to go ahead and change those bed sheets. So those were some of the highlighted recommendations. Now, if you were interested in getting a full training from this type of guidance about healthcare facilities and animal-assisted therapy programs, Shay has worked with the animal-assisted therapy organization Pet Partners to create a training module. Again, I am not associated with either one, so I'm not endorsing them. I just thought that this would be a good place to provide this information if you're looking for more specific guidance. Okay. We have come to the end. We have covered a lot of ground. We have talked about the health benefits as well as the health risks of animal-assisted therapy programs. But the bottom line is we have a very profound bond with animals, and they have the ability to help us heal. And that is amazing. So I would like to encourage you to consider how you could implement an animal-assisted therapy program within your facility or at your clinic, but how you might do so with very strong policies and guidelines in place to prevent zoonotic and reverse zoonotic diseases. I'm really looking forward to watching the success of your field and see how this is implemented as a treatment modality, and I just wish you all the best of luck. So this is my contact information, as well as the not therapy animals that I have on a daily basis in my life. And so please contact me if you have any questions. And then here is a brief rundown of the references that have been used for today's presentation. And I think now maybe we can do some questions.
Wonderful. Thank you so much, Dr. Barnes. That was fantastic. And like I mentioned in the chat, I will get your PowerPoint and send that out so that people can get those references. So
Perfect.